Hello, it's Dr. Rhonda Johnson. Today is Wednesday, July 6, 2022. Today I'm talking about COVID reinfection. You may remember that in the first year of the pandemic, reinfection with COVID was felt to be relatively infrequent because experts thought that our immune system, with its neutralizing antibodies, memory B cells, and T cells, would prevent the vast majority of people from getting reinfected for years. Indeed, there was a paper published in the prestigious Journal of Lancet in April 2021, which stated that a prior history of SARS-CoV-2 infection was associated with an 84% lower risk of reinfection, and the researchers felt that their work established that previous infection with SARS-CoV-2 induces effective immunity to future infections in most individuals. Well, what happened, folks? Then along came the Omicron variant, which had diverged from the other viral strains significantly. And a study published in Science in March 2022 said that the Omicron variant is associated with a marked ability to evade immunity from prior infection. And now we know that subsequent Omicron variants and subvariants, that reinfection is quite possible and occurs very frequently. In fact, according to the CDC website, reinfection with SARS-CoV-2 with the same virus variant as the initial infection or reinfection with a different variant are both possible. An early reinfection can occur within 90 days of the initial infection. So that's not real reassuring. In fact, the CDC says that the risk of reinfection varies by the circulating variant, and strategies to diagnose and treat reinfection are no different than those used to diagnose and treat initial COVID infection. So, fast forward to May issue of The Atlantic, where one epidemiologist from the University of Michigan suggests that we will get reinfected on average once every 3 years. Well, for some people, they have had their third and fourth COVID infection. So what that means for our health remains unclear. So is reinfection a good thing? I don't certainly think so. Some people equate COVID infection with the common cold or the flu, but sadly, folks, it is not, because COVID infection, whether it's asymptomatic, mild, moderate, or severe, can cause long COVID, and all the variants are believed to be capable of causing long COVID. Recall that the sequelae of long COVID can include new risk of diabetes, brain dysfunction, immune system dysregulation, chronic fatigue, heart disease, chronic lung disease, blood clotting, male erectile dysfunction, and other problems. And don't forget that folks are still dying from COVID. In fact, in 2021, COVID was the #1 cause of death in the United States for adults between the ages of 54 and 45 and 54. To me, that's the prime of life. So I don't want to have us get in a mindset that it doesn't matter if we get reinfected 3-4 times a year. You know, we have a vaccine strategy that is very important, but it's clearly not enough. Our post-treatment strategy, monoclonal antibodies and Paxlovid, is not enough because the virus may keep mutating and become resistant to different treatments. We really have to remember to focus on prevention of infection in the first place, and prevention of reinfection and reinfection and reinfection. And that includes masking, social distancing, hand hygiene, ventilation, and air filtration if we want to avoid the risk of reinfection. That's my message today. I hope you'll be safe and take care.